Hi, this video is for people who are thinking of seeing a clinical psychologist in the UK but who aren't sure where to start. There's a lot of information out there. It might be very overwhelming to some people. My aim is to make that process easier. I facilitate a referral service to my independent clinical psychology colleagues. Hopefully, the process then becomes as manageable as possible because many people are nervous about reaching out to see a clinical psychologist. My name is Jurai Daron-Karmas. I'm a consultant clinical psychologist. I worked in the NHS for over 30 years. I qualified in 1990 and I've done various psychotherapy trainings as well. So I have a broad range of approaches. I also know that the NHS is under a lot of strain at the moment, often with long waiting lists. So my role now is to help people find the right independent clinical psychologist. Many people are hesitant about seeing a clinical psychologist and actually making that first step in particular. Some people feel they should be able to manage alone. Some people aren't sure that seeing a clinical psychologist might help. But if you're needing this type of support and thinking about it, you've probably been soldiering on your own for quite some time, perhaps avoiding the nature of the problems until you can't avoid it anymore. The difficulties, the psychological distress, or the mental health problems are now to such an extent that you need to seek help. People try to cope as best as they can using whatever coping mechanisms are open to them, but sometimes having extra support is helpful. Clinical psychology, in some ways, is a little known profession, but there are more people becoming qualified over the years. So it's not about analysing you or judging you. It's about using our training in psychology to help understand how things are for you, how things got to this point, and what might possibly help, what would be a good way forward. The first step would be to understand this overview and then think about any particular psychological approaches or combination approaches. That would be a good place to start. The first place to start in seeing any clinical psychologist is to have what we call a psychological formulation. So as a result of the assessment, the getting to know you process, we have some understanding together of what are the possible causal and maintenance factors for your difficulties, and therefore we can have a plan for going forward. We're all HCPC registered clinical psychologists on my website, National Clinical Psychology Service. But just check that any clinical psychologist you see is properly registered with the HCPC, Health and Care Professions Council, because only people who've had the proper training can register with them, can call themselves a clinical psychologist, and thereby you're seeing someone in a regulated profession. So the first step is to reach out. For many, it's a big step and people have all sorts of worries. And it may take some time before actually making contact, time between thinking about it and actually taking that step. Usually the first step is to have a brief conversation and decide on a plan for the way forward. There's no obligation beyond that conversation, and sometimes people have said it's quite helpful to have someone listen to the overview. I wouldn't want to stir up things for you emotionally, so there isn't time to go into too much detail. And just staying at that overview level, the key headlines, if you like, and making it as manageable as possible for you. If you decide to go ahead, then we can talk about practicalities when you're available, when one of my colleagues, clinical psychologists who work independently in private practice, is available. If you prefer to see a man or a woman. So I'm hoping this little video has helped clarify things a little, and that is perfectly common for people to feel a bit uneasy, nervous, or very anxious about reaching out. It's a big step, but hopefully a doable one. So get in touch whenever you're ready. No rush. Okay, thank you.